Hello friends, today we are going to discuss about personality disorder. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be defining what is personality, what is personality traits, and personality disorder. I'll also be discussing about the diagnosis of personality disorder under DSM V and ICD 11, classification of personality disorder, prevalence, comorbidities, and management of personality disorders will be discussed in this video. Let's define what is personality. Personality refers to the enduring characteristics and behavior that comprise a person's unique adjustment to life, including major traits, interests, drives, values, self-concepts, abilities, and emotional patterns. This is what is personality means. Please understand, it should be an enduring characteristics and a behavior, that it's not a temporary or it's a part of a mental illness or after taking substances. It is an enduring pattern irrespective of those situation. It should be long standing. It should be a unique characteristics and behavior with regard to his life. It should be part of his major traits regarding his interests, drive, values, self concepts, abilities, and emotional patterns. This is what is personality. Invariably, there are many definitions have been given by various researchers with regard to personality. There is no one diagnosis which is accepted globally. In simple word, personality is the way of thinking, feeling, and behaving that makes a person different from other people. That means how one person can be differentiated from other not only by physical looks, the way he thinks, the way he feels, and behaves with other people. An individual's personality is influenced by life experiences, whether it is a trauma, how was his family support, what was his environment, what was the culture, family, religion, and also inherited characteristics like genetics also play a role. So, my dear friends, in simple words, personality is the way of thinking, feeling, and behaving that makes that person unique from others. Let's understand the personality from this small picture. There is an organism or an animal or a human being who is born because of his genetic vulnerability based upon the chromosomes he gets from the father and the mother. If they have some vulnerability with regard to mental illness or regarding certain personality traits, he will inherit them. With regard to early childhood experiences, adversities, or I also call them as past experience with regard to life threatening events or maybe childhood abuse events. Based upon these templates, that person will perceive certain events in the environment, situations, the people around him, and also the world around him. Based upon this perception, he will behave, he will think, and feel with regard to others, self, and the environment. The last part is the one which defines personality of an individual. However, there are various theories have been put forward to understand personalities. The most well accepted is five factor theory of personality. There are five important factors which has been considered, which are very important by factor analysis. First one is neurociticism, extroversion, openness, agreeableness, and consciousness. And these can be considered on a spectrum for each of the domain. Like for example, if you consider neuroticism, in that at one end of the spectrum, it is a depressive, emotional, and shamefulness. On the other end, and it is fearfulness and shamelessness. That means the five factor theory has been discussed very well. Now, the question is how to remember them. In a simple word, you can remember by a mnemonic called as ocean. O stands for openness, C for consciousness, extroversion, E, agreeableness, N for neuroticism. According to this personality, various dimensions which have been put forward, the first person to put forward was by Gordon Allport. He gave approximately 4,000 different personality traits. These were chosen from the dictionary regarding a person's personality, how he is explained. Later, the Raymond also had given 16 personality factors theory, but it was very confusing. Later, Hans Isaac offered three factor theory. However, the most accepted, well researched, and also critically evaluated is five factor theory of personality. Now, understanding about the personality, what is this trait? A trait is a particular characteristic. Personality is a cluster of characteristics. Here we are talking about a trait. A trait means a specific characteristic, quality, or a tendency that someone or something he has. Trait is a distinguishing quality as a personal character. A group of traits can form a person's personality. Again, trait is an enduring personality characteristic that describes or determines an individual's behavior across a range of situations, my dear friends. So, personality is a cluster of traits. A trait is a characteristic of one person about certain dimension. Now, the question is what is personality disorder then? Personality disorder are conditions in which an individual differs significantly from an average person in terms of how they think, perceive, feel, and relate to others. That means these are those people who deviate from the average person in the society. How do you consider them that they are deviating? Since their thinking, their feeling, and relating to others is different from a reasonable person in the society, and this causes distress in them, dysfunction in the society. They are unable to adapt many a time within the society. They are called as personality disorder. Personality disorders are also has been classified as a class of mental disorders characterized by enduring maladaptive patterns of behavior, cognitions, and inner experiences exhibited across many contexts and deviating from those accepted by the individual's culture. That means if it is sanctioned by the culture, we cannot call it as a personality disorder. It should be away from even the cultural sanction. The personality patterns developed usually in the early lifehood, that is, maybe in the childhood, develops into adulthood through the adolescence. They are inflexible and causes significant distress and also disability with regard to personal care, maybe also with regard to work, adjusting in the society. Personality disorder is a marked disturbance in personality functioning, which is nearly always associated with considerable personal and social disruption. You can say impairment in cell functioning can be seen and also interpersonal functioning, and it is manifested as maladapted pattern of cognition, emotions, experiences, and expression, and also the behavior. Now let's understand what causes this personality disorder. Invariably, at this point of time, we do not know the exact cause of personality disorder. At this point of time, available literature, research indicates to a multifactorial in origin, such as there is a genetic involvement. It's not a single gene, multiple genes are involved, multiple other factors such as childhood trauma, childhood abuse, the role models in the society, cultural factors, psychosocial and environmental factors, what are the brain changes, especially if there is head injury, substance use, medical causes sometimes, and even organic causes of the brain also can cause personality disorder, my friends. That means there is not a single cause for the development of personality disorder, it is a multifactorial in origin. Now let's understand how to diagnose personality disorder as per DSM 5. Now I'll be discussing about the general personality disorder. That means when to diagnose a personality disorder. I'm not going to the individual personality disorders. I'll be discussing in the other video every single personality disorder. A dedicated video will be made. This is about a general how a personality disorder should be diagnosed. There are 6 criteria have been proposed under DSM 5. And here they need to meet certain criteria to fulfill the diagnosis of general personality disorder. There are 4 inclusive criteria and 2 exclusionary criteria. Let's look into these 6 criteria. The first one is an enduring pattern of inner experiences and behavior that deviates markedly from the expectation of the individual's culture. This pattern is manifested in 2 or more situations. That means areas, my dear friends. It may be thinking, that is cognition, the way he perceives the event, perceives self, perceives others in the environment. That is about thinking. What about his affectivity, that is mood? His mood range, reactivity, intensity, ability, appropriateness, and emotional responses. The C is interpersonal functioning. How does he function within a group of people? How does he control his impulses? So this is the first criteria. Second one is enduring pattern, which is inflexible and pervasive across broad range of personal and social situation. The person behavior is not limited only at the workplace or at the family. It is in the multiple domains. The enduring pattern leads to clinically significant distress or impairment in social, occupational, and other important areas of their life. That means it's not only at job, not only at home, not only regarding biological function, any other areas within the society can be causing impairment and distress. Fourth one is the pattern is stable. That means that pattern should not be fluctuating. It is stable and of long duration, and its onsets can be tracked at least in the adolescent or in the adulthood. The enduring pattern is not better explained by the manifestation or consequences of any other mental disorder. It should not be part of any other mental disorder. Those symptoms cannot be attributed to that mental disorder. The enduring pattern is not attributed to the physiological changes such as substance use, drug abuse, or any other medical conditions, my dear friends. As I mentioned earlier, there are 4 inclusionary criteria, 2 exclusionary. Fifth and sixth is exclusions. That means personality disorder cannot be diagnosed when there is the symptoms cannot be attributed to other mental disorder, or it cannot be because of the mental substance use or any other mental or medical condition. Now let's move into the understanding the personality disorder, summarizing. First and the foremost, it should be an enduring pattern. It should not be transient. It should be enduring, long lasting. First one is the enduring pattern of inner experience and behavior. What does he feel inside? What does he think? What is his behavior? That is cognition, affect, interpersonal, and impulses. This is the first one. Second one is inflexible and pervasive behavior across domains, not on single domain, multiple domains. How is his behavior? And it should be inflexible. Distress and dysfunction in social and occupational area. Onset should be in adolescence or in early adulthood. And as I mentioned, 2 important exclusionary criteria. It is not because of other mental illness or not because of medical illness or any drug or substance abuse. Now let's understand the classification of DSM 5 personality disorder. How DSM 5 classifies it? DSM 5 recognizes 10 different personality disorder. DSM 5 organizes personality disorders based on the 3 clusters, based upon shared key features or clinical or symptomatology based classification. Unfortunately, there is no reason or etiological basis. It is based on the presentation of symptoms, my dear friends. There are three important clusters have been found: cluster A, cluster B, and cluster C. Cluster A is odd eccentric behavior. There are three personality disorders have been clubbed under cluster A: paranoid PD, schizoid personality disorder, and schizotypal personality disorder. Moving to cluster B, here the person will be dramatic and erratic, such as antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Moving to the cluster C, it is anxious and fearful. Here we are going to have anxious avoidant personality disorder, dependent personality disorder, and obsessive and compulsive personality disorder, my dear friends. So we have 10 personality disorder under DSM V, which has been classified. Now let's discuss about the diagnosis of personality disorder under International Classification of Disease 11, my dear friends. Again, I'll be discussing about the general personality disorder diagnostic criteria. ICD 11 classification of personality disorders represents a paradigm shift from categorical based approach towards the dimensional. They have moved away from the categorical. What is categorical? Categorical is whether the symptoms is present or not, whether the person in paranoid PD, whether he is suspicious or not. That means it is the presence or absence of symptoms will determine the paranoid PD. Similarly, for borderline personality disorder, whether the certain symptoms are present or not, that is categorical in nature. And hence, in ICD 11, they found this ICD 10 classificator system is based on symptom does not holds good. It is not based on evidence base. And it is basically a symptom classification rather than based upon evidence. Hence, they tried to remove this categorical basis and introduced a dimensional basis of personality disorder. However, the general description of personality disorder has been retained. In ICD 11, as I mentioned, personality disorder approach is through dimensional approach, not through categorical. Why there is a paradigm shift? First and the foremost, ICD 10 was earlier based upon the categorical approach, which is very complex. They came up with the 10 personality disorders which are based upon the symptom presence or absence, not based upon the severity of the illness. And ICD 10 categories which talked about a purer personality disorder, we hardly see them in our clinical practice. Invariably in the clinical practice, 50 to 70% of them are mixed personality disorder. The exclusivity of having only paranoid PD, having only borderline personality disorder, having only antisocial personality disorder is very rare to see. Even the research did not support this categorical approach of having symptoms present or not. Hence, they looked into the dimensional approach using 5-factor theory, my dear friends. And further, the research also clearly indicated inconsistency data were there when ICD 10 was considered. Further, the evidence-based research clearly said that the personality disorder does not come in a purer form, it comes in a mixed personality disorder along with comorbid psychiatric conditions, my dear friends. Hence, the symptom checklist based categorizing of personality disorder under ICD 10 was removed, and the importance was given to the severity of each dimension. Hence, my dear friend, the ICD 11 chose a different path of coming with a dimensional of the factors, which is 5-factor theory, which I'll be discussing in the next video. What are those dimensions? Please watch my next video. So then only you'll be understand what is this personality disorder and why ICD 11 moved towards this dimensional, and even the DSM 5 is moving towards the dimensional approach rather than the categorical approach of presence or absence of symptoms. Now let's look into the diagnosis of personality disorder as per the ICD 11. Again, in ICD-11 gives importance to the enduring pattern of disturbances noted in the functioning aspect of the self. How does he perceive himself? And also about the interpersonal functioning. How does he function within the society, having a good relationship with others? The disturbance has to be persisted over an extended period of time, at least for 2 years. That is the criteria they have given. The disturbance is manifested in pattern of cognitions, that is thinking, emotional experiences, emotional expression, and behavior that are maladaptive to the person and also to the society. And one need to understand the central manifestation of personality disorder has been noted that the impairment is seen both in the intrapersonal and interpersonal functioning. What is this intrapersonal? That is self functioning. What does he perceive himself? How does he identify himself? What is his capacity of self direction? What is his motivation in his life? How does he motivates himself to go outside into the world? That is intrapersonal. Next one is interpersonal. Here, functioning between the two individuals, maintaining close and mutual relationship, understanding the other person's perspective, able to manage the conflict in a relationship. How does it do that? So, the central theme revolves around the two important intrapersonal and interpersonal. Symptoms should not be attributed to the effect of either medications or drugs or substance use. The substantial distress which is occurring or significantly impairing should be in the area of personal, family, social, educational, biological, and also job. That means it should be impairing multiple areas of his life. And personality disorder should not be diagnosed if the developmental or the disturbances are not developmentally appropriate or can be explained primarily by social or cultural reasons should not be attributed. What are the other additional features of ICD-11 diagnostic criteria? Although if they are there, it is good, it adds to the diagnosis, but it is not mandatory. Hence, they are considered as additional feature. A history of early childhood, adversity, abuse, ongoing behavioral and emotional trauma, interpersonal difficulties may suggest personality disorder. If they are there, it's well and good. Treatment unresponsiveness for any clinical disorder indicates the possible presence of PD. That means if you're treating a person with medications for a person who is having depression, if you treat but still the symptoms are not remitting, please check for personality disorder. That means personality disorder do not respond immediately for medication. There is a marked difference between the individual self description and the informant description, telling that there is some serious issue with this person. That means when you ask a person, describe yourself, he may give certain traits that he is a good person, he is very communicative, he is joyful, he is social. When you ask his family members, what kind of person is your brother? They may say he's highly introvert, does not go outside, is sitting inside the house. That means there is a marked disturbance between the person's his own explanation and the family members. That means we are dealing with a personality disorder, my dear friends. Let's look into the ICD-11. What is the dimensions which have been placed? The dimensions of severities are, first one is personality difficulties, mild personality disorder, moderate personality disorder, and severe personality disorder. What is this mild, moderate, severity? The reason this has been brought into this dimension aspect is the outcome of personality disorder is based upon the severity of the personality disorder. It is not the type of personality disorder, my dear friends. The more severe the personality disorder, the most worst is the outcome as per the available literature, my dear friends. This is the dimension of severity has been added in the ICD-11, of course, even DSM V. Let's look into the dimension, how this severity is being assessed. How do you say it is just a personality difficulty? How do you say it is mild or moderate or severe? It is the degree and pervasiveness of this impairment. What are those impairment? Impairment should be disturbance in the functioning aspects of self and also interpersonal. Interpersonal dysfunction should be in the various contexts, like maybe within the family, within the society, maybe at the job place, workplace. So that difficulty of interpersonal, how much is his emotional, cognitive, and behavioral manifestation of this symptom should be considered. Dysfunction or distress or impairment with regard to family, personal, social, educational, occupational, and other important areas of dysfunction should be considered for the assessment whether it is difficulty only, mild, moderate, severe. And also, ICD-11 talks about 6D11, that is prominent personality traits or pattern. What does it mean? You have diagnosed a personality disorder. What is that prominent trait should be classified here. Those dimension which has been added under the ICD-11 are placed like this. There are 5 important, but however, 6th came forcibly as a gate crashing. That is, borderline personality was added. So let's look into the first one. Negative affectivities as a dimension, dissociality as a dimension, disinhibition as a dimension, and anancassia is another dimension. These are the 5 dimensions which need to be considered when you are telling a person has a personality disorder, and moderate detachment, mild negative affectivity, disinhibition is marked, and anancassia is nil. So, based upon this classification of domains and a personality disorder, you are going to give a dimensional aspect, my dear friends. Then, what is this personality difficulty? Individual with milder personality characteristic that does not rise to the level of severity to merit a diagnosis of personality disorder may be considered as a personality difficulty. That means he may have some mild personality traits, not a syndromal one. Sir, how does it done? Do we have any kind of scale? Although you may find a scale, but it is the clinician prerogative and his experience based upon the person's difficulties, disturbance, dysfunction, internal distress caused by that. Based upon that, either you will say he has a personality disorder if it is severe, or else it is very, very minimal. We call it as a personality difficulty. They may affect the ongoing treatment. They may have, a person may have depression and personality difficulties like anxious personality may be there, and it may not be a disorder. In such a scenario, we call it as personality difficulties. In contrast to personality disorder, the personality difficulty is manifested intermittently or with a low intensity. It may come and go. They do not cause notable distress, disruption in social, occupational, and biological function. There will be very little dysfunction, and even if the dysfunction is there, it is fluctuating, my dear friends. Let's conceptualize the PD after understanding about DSM 5 and ICD-11. We need to understand in DSM 5 and ICD-11, we moved away from categorical approach of personality disorder to dimensional approach, that is based upon severity of the personality disorder. And we need to conceptualize based upon the definition how the personality is being classified, defined. There are various definitions, hence personality disorder is very difficult to define at times based upon the cultural role, person's insight whether he has personality difficulties or not, conceptualizing what the personality means, categorizing based upon the symptom or the severity or the assessment, how the assessment is. So, based upon all this, you need to understand personality disorder is not just a disorder by the virtue of having symptoms, it is the virtue of severity of the symptoms within the society, my dear friend. At present, the diagnostic systems are moving towards the dimensional approach based upon the severity of the symptoms. Hence, the current understanding of personality disorder means you need to do a 360-degree assessment in the society, at the workplace, at the place where he mingles with other people in the society, based upon the distress, dysfunction, and interpersonal problems, you are going to make the diagnosis of personality disorder. Now, let's look into this prevalence of personality disorder. How common is it? There was a systematic review and meta-analysis done by Winsper and his colleague, which was published in British Journal of Psychiatry in 2019, my dear friend. This is a very important landmark meta-analysis. The title of the study was The Prevalence of Personality Disorder in the Community, a global systematic review and meta-analysis. Let's look into the number of studies which were reviewed. They did a global review and meta-analysis, including 39 studies, my dear friends. These are the 39 studies which were included under the systematic review and also in the meta-analysis. Let's look into the results, my dear friends. The global prevalence of personality disorder, and it is based on the DSM V. The top one you can see is any personality disorder. Let's look into the any personality disorder, and it is each of them has been classified into high income country and low income country, the prevalence. Any personality disorder, if you take in the high income country, it is 9.4%, my dear friends, and in the low income country, it is 4.3. And if you combine both, global prevalence is 7.8%, my dear friends. Now let's look into the cluster A. In the cluster A, the high income country is 4.2. In the low income country, it is 3.4. What is the global prevalence? It is 3.8%. Let's look into the cluster B. The cluster B is high income country is 3.7. Low income country is 1.5%. The global prevalence is 2.8%. Let's move into the cluster C. High income country is 6.6. Low income country is 3.3. And the overall of the cluster C is 5.5%, my dear friends. So this is how the prevalence of personality disorder as per this important meta-analysis. But however, the prevalence of this personality disorder differs based upon the population you are studying. If you are studying a prevalence of personality disorder in a mental hospital population, it is 50%. Based on primary care population who is visiting the primary care center, it is 20 to 30%. If it is based on the prison population, it is 2/3 of the prison population have one or the other personality disorder, my dear friends. However, as per the World Health Organization, World Mental Health Personality Disorder Prevalence Estimate is 6%. The global pooled prevalence of any personality disorder is 7.8%. Based upon various studies, based upon World Health Organization, we can summarize that the global prevalence of personality disorder somewhere it is 4 to 8%, cluster A is 3 to 4%, cluster B is 2 to 3%, and cluster C is 4 to 5%, my dear friends. So, you need to remember the prevalence of personality disorder is somewhere around 4 to 8%, my dear friends. Now, let's understand what is the comorbidity which is seen in personality disorder. Comorbidity is coexisting mental disorder. Based upon the personality disorder population, the comorbidity is two-way. The person with personality disorder has comorbid psychiatric diagnosis. Many a time, patient presents to a psychiatrist with primary diagnosis of axis 1, that is mental illness, but you can see a comorbid personality disorder also. That means reverse comorbidity is also true. PD can cause psychiatric illness. Imagine a person with borderline personality disorder, if it is untreated, he will end up having depression. Similarly, a person with antisocial personality disorder over a period of time may end up having substance use or substance dependence. Similarly, a person who has mental illness from the childhood may have a pathoplastic effect on his personality defense, on the personality development. Hence, reverse comorbidity is also true, my dear friends. If you look at the common comorbidity seen in cluster A is psychosis. The commonest comorbidity seen in cluster B is substance use, psychosis, affective disorder, and anxiety disorder. If you look into the cluster C, eating disorder, depression, and anxiety disorders are the commonest comorbidities seen in the personality disorder, my dear friends. What are the other commonest psychiatric comorbidities seen? As I mentioned, depression, dysthymia, recurrent depressive disorder, substance use, substance dependence, anxiety disorders such as generalized anxiety disorder, social phobia, OCD, eating disorder, childhood onset illness, which have a pathoplastic effect on the personality disorder, suicidal attempt, suicidal ideation, death by suicide, various other medical illness and accidents are common in person with personality disorder, and this can be considered as a comorbidity both for medical illness and also mental illness. Now let's discuss about the management of personality disorder. The management of personality disorder is based upon the assessment. The assessment of the risk to self and risk to others. Whether there is a presence of comorbid psychiatric condition or medical condition, what does he thinks about the self identity and interpersonal relationship, whether you want to do a multiple domain assessment, whether there is insight, functional and dysfunctional assessment. Based upon this assessment, you will plan for the intervention, my dear friend. Let's look into the assessment. What are the ways the assessment is done? Assessment is based upon reliable and adequate information not only by the patient himself, by family members, friends, and colleagues. Hence, there should be a detailed evaluation to be done. During the detailed evaluation, do not jump into a diagnosis of personality disorder unless you get a 360-degree evaluation information, not only at the family level, at the society level, at the job level, and even if he's studying academic institution. Hence, a 360-degree assessment should be done. The patient should be willing and cooperate for the assessment, give consent so that we can discuss with the other family members and relatives regarding his personality. And many a time you require multiple sittings. Prospective follow-up and observation is the gold standard for the diagnosis of personality disorder rather than by doing any projective test or a scales. Of course, they are helpful, but the gold standard is the clinical assessment. Hence, the assessment is based on the following parameters such as demographic details, cultural context, social context, the way he is presenting, family background, psychosocial stressor, previous history of violence, self stressors, childhood abuse, whether he had self harm, previous response for treatment and supervision, past history of psychiatric illness, social support and family support, how much is his impulsivity, anger, substance use, drug abuse, presence or absence of mental illness. These are the areas you need to give importance when you are doing assessment of personality. Let's look into the assessment patterns. Assessment patterns are: one is unstructured assessment, semi-structured assessment, structured. What is this unstructured? It is based upon a clinical evaluation by the clinician. Unstructured is a combination of structured and unstructured assessment. Structured is there is a scale given. Based upon the scale's questions, yes or no, and based upon the severity, you are going to make a diagnosis. Personality assessment is very complex, my dear friend. Hence, there is no gold standard. The gold standard is basically a clinical assessment. Let's look into the constructed interview assessments. The commonest used is International Personality Disorder Examination, diagnostic interview for DSM V personality disorder. Now, slowly, the fifth is coming up: Personality Disorder Interview 5, Standard Assessment of Personality Disorder, Personality Assessment Schedule. Let's look into the self-rated interview. Questionnaire basically, Personality Diagnostic Questionnaire, Personality Assessment Inventory, Minnesota Multiphasic Personality Inventory, Million Clinical Multi-Auxiliary Inventory, ISAC Inventory Questionnaire, Unstructured is Clinical Assessment, and also Rorschach Test, actually Rorschach Test, and TAT, that is Thematic Appreciation Test. Both are projective tests. You can consider it as a semi-structured, my dear friends. Now let's discuss about the management. Once you are diagnosed, before you diagnose, please do a 360-degree evaluation. Do not jump into a diagnosis of personality disorder unless you have adequate information, or else provisional diagnosis of personality disorder can be kept. First and the foremost, based upon the severity, suicidal ideation, harm to self and others, either you can do a inpatient treatment or outpatient. If the patient requires medication for comorbid conditions like depression, anxiety disorder, please consider antidepressants. If he has bipolar affective disorder, mood stabilizer, antipsychotics, the priority will be diagnosing and treating comorbid psychiatric condition and medical illnesses. Once you treat the comorbid condition, then do the personality assessment, my dear friends. Once you have treated the axis 1 and you have done the personality assessment and you feel the person has predominantly paranoid, you can give antipsychotics. That means the medication is more of symptomatic treatment for the personality symptoms. The radical treatment will be psychotherapy. Either it will be individual psychodiagnostic therapy or psychodynamic therapy. It can be cognitive behavioral therapy can be considered, or if the person has borderline personality disorder, the best treatment would be DBT, my dear friends. That is dialectical behavioral therapy. You can also consider if the interpersonal domain is the major area, then you can consider interpersonal therapy. Many a time you can consider group therapy or else social skills training based upon the assessment, based upon the dimension where the patient is showing deficit, dysfunction, distress. That is the area you are going to target in the assessment and treatment in psychotherapy. Let's discuss about course and outcome. Most of the personality disorder has a chronic course and poor outcome. There will be frequent relapses. Treatment resistance is the biggest problem because many a time they refuse medication. They do not cooperate for therapy. If they have a good insight and they are in touch with the treatment facilitator or a treatment provider or with a therapist, the outcome is considered as fair. Invariably, they end up in litigation, divorce, separation from the spouse, conflict with law, recidivism. They get arrested very frequently. They will have psychiatric morbidity and medical illness morbidity, and few of them may death by suicide are common. Although the personality traits are largely considered as enduring, consistent, but by the end of fourth and fifth decade of life, the symptoms starts melodowning. Although they are dynamic in nature, during the stressful situation, you can see the symptoms flaring up. Invariably, by the end of fourth decade of life, the personality starts stabilizing. You can see the improvement in their personality structure. That means they become more sociable and functionable in the society. The clinical factors which play a crucial role in the course and outcome is presence of another psychiatric diagnosis, presence of substance use, drug abuse, whether they have insight or not, how well they are compliant for therapy, treatment compliance, homework compliance, whether they are in touch with the treating team or with the doctor, and regular follow-up. These are the variables which play a crucial role in the outcome, my dear friend. To conclude, personality disorder involves a long-term pattern of thoughts and behavior that are unhealthy and inflexible. Hence, it is called as enduring personality characters, the way they think, the way they feel, whether they interact in the society, my dear friend. These behaviors cause a serious problem with relationship, within the family, within the friends, or even at the workplace. People with personality disorder have trouble dealing with everyday stressors and also problems. Personality disorder come in the way of treatment of any chronic mental illness and also medical illness. They may refuse taking treatment, they refuse accepting they are ill. Invariably, most of them do not have insight, my dear friends. Hence, it will be difficult to engage them in treatment. And of course, the treatment and management is based upon the severity of the illness, presentation, dangerous to self and others, suicidal ideas, suicidal attempt. Based upon that, you will decide whether you will treat inpatient or outpatient. Based upon the symptom profile or a dimension profile, you will choose medication or psychotherapy. My advice would be the combination of both medication and psychotherapy play a role in personality disorder, my dear friends. Thank you very much for giving your valuable time. Stay safe.